Hello, everyone. Thank you for joining us today. I'm Jenny Aiken, co-director of Applied Research here at Blue Star Families. The Connected Communities Impact Study began in 2018, and it has been my honor to see it through to its completion. CCIS was made possible with financial support from the Bristol Myers Squibb Foundation and research support from the Sorensen Impact Center. After years of hard work, we are excited to share that our chapters work the way they were designed to. They provide the building blocks toward belonging for military families. Over the course of the next hour, we will dive deeper into the research and share reactions from community members and funding leaders. We're so happy you're here, and we're excited to engage with you today. As the conversation progresses, please take some time to engage with us in the chat to the right of your screen. We want to hear what you think, what your questions are, and what you're excited about. The Blue Star Families team is eager to chat with you. I'll see you there. Now, I would like to welcome Catherine Grimes, Bristol Myers Squibb Foundation. Catherine and her team have been key partners of Blue Star Families for many years, and we are grateful for the opportunity to work beside them on this important study. Catherine, I'd like to welcome you to speak with everyone today.
Good afternoon, all, and welcome. My name is Catherine Grimes, and I'm a director at the Bristol Myers Squibb Foundation. I'm so pleased and honored to have been asked to welcome you today as we share the results of this important work, the Blue Star Families Connected Communities Impact Study that we embarked on with Blue Star Families 3 years ago. At the Bristol Myers Squibb Foundation, over the past decade, under our Veterans Mental Health and Wellbeing Grant Program, we have focused grant making on addressing the myriad of challenges that transitioning veterans face when reintegrating into civilian society. Working primarily in the veteran space, when I first met Kathy, I was much less familiar with the challenges that active duty families face. Kathy helped raise to my awareness the challenges that military families face, and in particular, the very real challenge of the frequent moves, every 2 to 3 years on average, and how these moves, landing them far from families, friends, and support networks, leave them isolated and with a sense of lack of belonging to their communities, and how that can have negative effects on their overall well-being. Once I understood the magnitude of the challenge, I was motivated to help find a solution. And for those of you who know Kathy like I now do, you know that Kathy is not only solutions-oriented, but she's data-driven, and she is a force determined to protect and serve her fellow military families. Given that the Bristol Myers Squibb Foundation is a science-based foundation relying on research to develop the evidence base for the work that we fund, I knew I had found the perfect partner to embark on this work with. In Blue Star Families, Kathy had started a grassroots organization to create a support network for military families. And she wanted to know if by moving the organizational model from an all-volunteer to a staff-led model, if she could increase the impact of her organization's work. And because Kathy is data-driven, she didn't want to make any assumptions. She wanted to test the hypothesis and gather data and evidence through an impact study. And again, because we're a science-based research and development foundation whose strategy is to empower our grantees to build innovative solutions to pressing problems, to develop, implement, and evaluate innovative programs with the goal of creating long-term sustainable solutions, it seemed apparent that the Connected Communities pilot was exactly the type of creative and innovative approach that we aim to support. The hypothesis behind the pilot was that Blue Star Families programming, which builds purposeful, meaningful, and lasting connections between military families and their local civilian communities, is directly related to elements of improved social capital, which in turn are significantly associated with belonging. By bringing on paid staff, she would have more fidelity over the model as she looked to replicate and scale it. The pilot was carried out in 2 communities, New York and San Diego. The desired result was to enable Blue Star Families to create a replicable and scalable model of community connection to address this very complex, multifaceted issue of loneliness and isolation in a comprehensive and strategic way. We are excited to unveil the results of this very important study with you today. I am so grateful to the Blue Star Families team for allowing us to be a part of this important work, and I look forward to seeing how you and others will use this research to continue to impact and support the military community. Jenny, I'll turn it back to you.
Thank you, Catherine. This has been a meaningful journey together so far, and we at Blue Star Families look forward to continuing our relationship for many years to come. We were also fortunate to work with the Sorensen Impact Center to help bring the chapter model to life and share the findings of this study. We'd now like to share the video they created with you.
My name is Tennille Shemaiah Jones. I live here on Camp Pendleton with my mom and my son Joshua. I work here in the 21 area because I'm also an Army reservist.
Military leadership has recognized that military family readiness is military readiness. Taking care of those families and having resources and outlets for them helps prepare that military service member for deployments, be successful to go to work every day, knowing that his family is taken care of, her family is taken care of, that they have a community that supports them.
It's hard being a single mom. It's definitely hard. I make sure that I ask for help when I need it. I think Blue Star is great in providing that connectivity with other families.
I like Blue Star Families because they're taking time out of their day to work really hard for families, for them to have fun.
I found out about Blue Star Families on Facebook. There was an event posted for military families down in San Diego, and I said, okay, we're a military family. Let's go and see what's going on.
I thought it was just a tour, and then they took us to this big room, and they surprised you with this custom skateboard. I felt really good.
The day before we went, he asked me for a skateboard, and I was like, Josh, I don't have the money for a skateboard. And the very next day, he got a brand new skateboard. He was super excited. Like, he couldn't believe it. I think it's important for Joshua to know he has a parent that loves him, but also because he is growing up in a single parent home. I think it's important that he's connected and has that moral support.
Blue Star Family keeps growing. We now have over 260,000 families involved with us. We have 11 chapters. So I'm excited to build chapters in every state. And when we're everywhere, then wherever you go, you can know that there is a group with arms welcome to catch you. When people move again and again, and they're moving next to neighbors who might not know they're there, if you don't have someone you can turn to when you need help, problems get worse. We started asking questions about belonging. Do you feel that you belong to the community in which we live? And we found out about half of military families in our first survey say, no, I don't feel that I belong. I would like to. And a full third of people in our survey have no one that they can turn to if they need help in the community where they live.
I am an Army veteran. My husband is on active duty. I have 2 children. We've lived in 5 different states. I would say the hardest part is definitely not seeing my mom as often. This last move was probably one of my hardest moves. No one was there to help me navigate or just kind of be the buffer. I have a friend who, she actually is the Blue Star chapter director. She said, try this program. So, I do a little research. And I said, okay, this is something I'll be interested in. So I tried it out. And little did I know that day was going to be life-changing for me. I met my friend Brandy. I love being with my family. I love being with my kids. But I also need an outlet from that. I just needed one friend. That's it. Just one. Just to know that you have somebody you can count on to come through when you need it. By having those connections, that relationship within Blue Star Family, it also helps benefit and support my community.
I think in general, people are not meant to live this life alone. Blue Star Families reaching out and having those resources to help our families feel connected, bringing our military families to the community organizations like museums, like parks, theater. That has been such a blessing.
It's a pleasure and a privilege to serve your country, but no one's going to do it if it hurts their family. Because as much as we love our country, we love our families and we have a responsibility to our families. Blue Star Families supports military families in ways that strengthen local communities. Our funders need to know that their dollars make a difference, not only for that family, but for the whole community and really for the strength of the country. And we really welcome everybody who can join us to be part of this mission.
Thank you to the Sorensen team for that beautifully produced video we just watched. Now I'd like to introduce and invite John Zadra from Sorensen to join me in a deep dive into the research findings. John, would you like to introduce yourself?
Yes, thank you, Jenny, and thank you for having me here. It's my pleasure. This has been a great project. So briefly, I am a director of data science at the Sorensen Impact Center. And the center is a small nonprofit. We work with a lot of other nonprofits for things like evidence-based policy and decision-making, program evaluation, and of course, lots and lots of data science. So thank you for having me. Jenny, I'm wondering if, before I start on the actual model and results, if you'd like to lay out what Blue Star Family Chapter's theory of change is. That is, what exactly are you doing and working on, and what do you hope that those efforts will change or improve for military families?
Yeah, absolutely. So Blue Star Families chapters began as a way for military families who move more frequently than their civilian peers, and often live far from family and friends, to quickly connect to a support network in their new community. We envisioned a nationwide network that would become familiar and a predictable resource in what is often an unpredictable military life. We designed our programs to mitigate the impacts of fundamental military life challenges we consistently identified in our annual military family lifestyle survey. Things like the lack of a strong social support network, the lack of understanding across the civil military divide, chronic military spouse and underemployment, and all of the downstream mental health effects that these things exacerbate, particularly among military spouses. These are all links to belonging in the literature. So Blue Star Families chapters are designed to improve military families' sense of belonging to their local communities by connecting them to others in that community. Using this approach, we hope that military and civilian families organically develop the authentic networks of mutual support that improve the size and quantity of their social networks. In other words, they're designed to give you the building blocks towards belonging. And it's been great to work with you, John, and your team to understand whether or not they're working in the way they're designed to. So now that I've laid out the theory, what do we find?
Yeah, thank you. And again, this is the kind of data that we love because it helps people, and it was so rich. We had so many questions and so many participants. So it's been a real pleasure to get to work on it. So the way that we ran this study, it went over about a 3-year period, including the time afterwards to analyze everything. But during that time, we fielded 5 different surveys, 3 to 5 months apart. And we targeted military and veteran families living within 100 miles of San Diego and California, both by direct email, as well as posting ads and links on social media. So we mostly were interested in how many events they had attended and how that affected other things. We included not only participants that had been to an event where we asked them how many they'd been to, but we of course also wanted to know about people who had never been to a Blue Stars event and compare them to those who'd been to one or more. So we designed our models to look at primarily our main variable of interest, which was how many events a person had been to in the past 3 months. But we also wanted to understand a number of indirect effects that might have contributed, things that the literature says bolster belonging or are associated with positive mental health effects and well-being. In addition, we included a bunch of other factors that might have been potential confounds. For example, people's personality might matter a lot. Extroversion might explain a lot of the effects. And so we want to include those to make sure that they aren't the reason we're seeing the effects of the number of events attended. So all of the findings and the effects that we present in the report were all statistically significant. We used various forms of regression analyses as was appropriate to the distributions of the data. But one thing I want to note is that because this wasn't an experimental design, we can't necessarily infer direction or causality. We just know that the things we've measured are or are not associated with each other. However, it is important to remember that because this wasn't an experimental design, we don't necessarily know the direction of the effects. And one other thing I'll note is that we know from previous Blue Star Families research that the amount of time it's been since someone moved to their community can have effects on some of the other things we're measuring. So for all of these models, we also included how long it had been since they moved to account for any effects that may have had. So Jenny, as you alluded to earlier, belonging is complex. There's a lot that goes into it, both how many people you know, but also perhaps how close you are with them. So we actually, when measuring belonging on its own, hadn't expected it to have a direct effect with the number of Blue Star Families events attended. So we hadn't expected to find a direct effect of belonging with how many events they'd been to. But surprisingly, for people who had been in the community for more than 4 years, there was actually a positive association where the more events they attended, the greater sense of belonging they had. More importantly, we found what we theorized. The more events that people had attended, the greater the quality and quantity of their social connections. And in addition, there were a number of indirect effects with things like better mental health, especially positive affectivity, as well as belonging. We also explored a number of other variables which you, Jenny, thought might be associated with belonging, but hadn't previously been researched. And I'm wondering if you'd actually like to tell us a bit about, having seen those, what surprised you?
Yeah, absolutely. And I'm so glad that we did, because they all have implications for how we implement our programs. First of all, we found that one's satisfaction with their employment situation is far more important than simply having a job. This satisfaction was significantly associated with every outcome variable we tested. Second, going into this study, we assumed, based on the research we had conducted to date, that increased time in community was associated with good things all around. But this research really helped us understand that increased time living somewhere isn't universally positive, at least for the military and veteran respondents in our sample. Specifically, greater time in community is associated with significantly fewer people the respondent felt able to talk to about one's problems. I'm very interested in exploring this further. We know that military families often have more military friends than civilian friends. What this finding could suggest is that when a military family moves, that move isn't just impacting that family, but also the friends they leave behind. We don't know if this is the cause, but I do look forward to digging deeper into it in the future. If that's true, it increases the importance of our programs. We as military families need local civilian supports. Finally, as we both expected, personality traits matter. Extroverts and introverts are looking for different things. Individuals who are highly conscientious don't have as much social capital, at least in our sample. So we now know how important it is to really take these things into consideration during program design and implementation. So because we know that all of these things have implications for how we design and implement our chapter programming at the local level, we developed a series of recommendations. You can see them on the slide here, and they are explained in more detail in the report. I want to thank you, John, for coming with me today to explore our findings, and to all of you for allowing us to share them with you today. We look forward to answering your questions in the chat.
Thanks a lot, Jenny. It's been a real pleasure working with you, and I'm glad that we could contribute.
John, thank you for joining me to share these insights today. I'm so proud of the work we did on this research over the past few years, and I'm eager to hear what some of our friends and community partners have to say about the findings. I'd like to turn things over now to Greg Behrman, CEO and founder of our partner in this great event, NationsWell, to facilitate a discussion with some of our friends and funders. Greg, would you like to introduce the great panel of community friends and partners we have with us today?
Thank you, Jenny, and thanks so much for inviting NationsWell to be a part of this terrific event. The research you've compiled is impressive, important, compelling, and I'm really eager to discuss the findings with this prestigious panel that we have gathered today. Let's get right into the discussion. Joining us today are Rachel Hutchison, VP Corporate Citizenship and Philanthropy at Blackbaud.
Hey, Greg, thanks for having me.
Always good to be with you, Rachel. Catherine Grimes, Director, Bristol-Myers Squibb Foundation.
Hey, Greg, honored to be here.
Next, we have Assembly Member Tasha Berner-Horvath, California State Assembly, 76th District.
Thank you so much, everybody. Good to see you, Greg. It's good to see everybody here. Thank you for having me. It's a joy to be here.
Nice to be with you. Natalie Kylander is next. Natalie's a Managing Director at Draper Richards Kaplan Foundation.
Hello.
Hey, Natalie. And our friend Vilas Dar, President of Patrick J. McGovern Foundation.
What a great company to be in. It's really a pleasure to be here.
Good to be with you. Next, we have Debbie Anderson, Programs Director at Rancho Santa Fe Foundation.
Hi, everyone. Thanks for having me. It's a pleasure to be here with you all.
And next, Fagan Harris, who's VP for Impact and Community Development at Rethink Development Partners. Welcome, Fagan.
Hey, thanks for having me, Greg.
You got it. And then our good friend Megan Glavin, who is Director of Social Impact at the Starbucks Company.
Hi, everyone. Great to be with you. Thanks, Greg.
You got it. And then finally, Kathy Roth-Duque, who's well known to this group, who is CEO at Blue Star.
Thanks, everyone, for being here. And hi, everyone.
Well, thanks, Kathy, for bringing us together. So Rachel at Blackbaud would love to kick off with you. Companies, if they are intentional and do the right things, can have a huge social impact. Do you see any parallels in the sense of belonging from the study with a sense of belonging from an employee engagement standpoint? And we're interested in particular in your thoughts of employees being agents for good and companies being conveners of people and ecosystems of good.
Yeah, for sure, Greg. And I do see parallels. That was the thing that really struck me when I looked at the results, that, as you know, through other NationsWell conversations we've had, I'm really, really interested in community. You know, I lead corporate social responsibility at a technology company. We work in the world of technology for social good. So our people are all about joining together, serving, being a part of community, but they often come to us expecting us to help plug them into community. And because the world is a little bit different now, you know, there's a great book by Robert Putnam years ago, Bowling Alone, about how people weren't sitting on their front porches anymore because of air conditioning. They were inside watching TV. We work a lot. We're all more disconnected than we used to be, although we're more technologically connected. So we already have this world where we're not as connected, but people are looking now to their employers to wire them in. And so I was already thinking about that and how do we connect people. And I looked at this research and it's like, wow, it makes so much sense of, you know, military family moving around, not necessarily having the base, being in a neighborhood where they don't necessarily know their neighbors. Well, how many people actually know all of their neighbors today, period? You know, that's something that's happening more and more. And then we have COVID, and all of a sudden the people who we are most connected to through work, we're only connected to through our computers. So I've been thinking about that added burden and really the kind of extra burden on mental health of us employees not seeing each other in the elevator, not just, you know, that human connection that we're missing. So I do think there's some real parallels. And very briefly to your second point, you know, people come into the doors of a company, virtually or not, bringing their whole selves and wanting that company to connect them into ways to give back and to meet other people. And you know, companies now, you know, are becoming these, I think of them as conveners of people who, because they want their people to be engaged, because they want them to stay at the company for a long time, they're more actively looking at how do I recognize that individual employee, but also plug them in. And so to me, companies are becoming much more an important part in that connection to social impact. They're kind of a conduit that we didn't really think about before. So for sure, it's all about belonging. And I love the parallel between the kind of military experience and now what we're all feeling as these people who sit and do their work from their homes.
Rachel, thanks so much. That's a great perspective. We're grateful to you for sharing it. Next, I'd love to bring in Catherine at Bristol-Myers Squibb Foundation. Catherine, I know your team was intimately involved in the research for the project. So it's a pleasure to bring you in and to ask, how are community-based supportive services programs having a positive impact in building stronger and more resilient communities?
Yeah, thanks, Greg. Really, at the Bristol Myers Squibb Foundation, community is at the heart of everything we do. We've been doing this work of mobilizing communities for greater health outcomes and building capacity and capability in communities to deliver community support services for vulnerable patients for more than 20 years. And over that time, we have seen that the most successful programs, those that create real and long-lasting impact, are the programs that are well integrated into community. And specific to our veteran work, over the past decade of running the Veteran Mental Health and Wellbeing Grant Program at the Bristol Myers Squibb Foundation, we have seen more supporting data released about how important creating community connection is to maintaining individual mental health and well-being. The Connected Community Studies is just one example. I'll give 3 more specific examples of some of the work that we funded and the impact of those projects. So first, an example would be our partnership with the University of Michigan to develop a peer support program for student veterans, creating a sense of community and belonging to these atypical students in this pivotal point in their lives when they're gaining higher education. The data showed that depression rates were high among student veterans and degree completion rates were low. In the research study of PAVE, or the Peer Advisor for Veteran Education Program, improvements were seen in sense of belonging on campus, depression rates were reduced, and degree completion rates were higher than national averages. A second example I'll provide is our partnership with Volunteers of America on a project focused on improving veteran mental health and well-being by educating and raising awareness of and providing treatment for a moral injury in community settings. The program has built and tested a network of trained veteran community members as peer coaches. These veteran peer coaches are trained and are delivering the resiliency strength training modules focused on moral injury recovery in transitional housing settings. The project has shown success in significantly improving post-traumatic growth and has developed a model that Volunteers of America is now scaling across their chapter network nationwide. I'm proud to say the results of that research was published in December in the Journal of Veteran Studies. And lastly, Project ADAPT, run by a team at the University of Minnesota's Institute for Translational Research in Children's Mental Health. This program is aimed at improving military family resiliency via a large-scale implementation of the evidence-based ADAPT program. ADAPT stands for After Deployment Adaptive Parenting Tools. It's being implemented on the base at Fort Bragg, one of the nation's largest installations, and within the medical system of care at Womack Army Medical Center. By providing parents access to this community-based intervention, by providing routine mental wellness and resiliency screening during well child visits, this project will help to normalize help-seeking behavior for military parents with young children. Those families that are flagged as at potential high risk for family stress are offered a multitude of supports and tools that they can use at home and practice in real life situations to be better equipped to de-escalate otherwise stressful situations. They're also provided 24/7 urgent response support if they're not able to de-escalate the situation. So I hope that's both answered your question and provided some specific examples beyond the Blue Star Families Connected Communities Impact Study of how we think about community support services and the impact of some of our funded work.
Catherine, those are great insights and great examples. Thanks so much for bringing that into the conversation. Next, I'd love to engage Assemblywoman Horvath. It's so nice to be with you. I imagine it's been quite a year to be a public representative.
That is definitely true. I don't think I ever thought when I ran for assembly that I would be leading during a pandemic.
well, here we are, and definitely want to bring in your perspective. The findings show that genuine engagement helps to foster a sense of belonging in community. I imagine there's an important role for local communities to play in this effort. So if you could speak a little bit to that, and how do we encourage civilians in military communities to do their part to help foster this sense of belonging?
Yeah, absolutely. I think it's a great question. As an assembly member, I have 2 roles kind of. I have one role where I make laws. So whenever I talk to my kids and my kids' friends ask, "What do you do in Sacramento, Mom?" And I said, "I assemble laws." And so we have the lawmaking side where we're looking to really help our military families, whether that's through certification programs and all those things. But then we, also have this really important role through my district office of ensuring that we are lifting up those organizations that help integrate our military families. San Diego County is a huge military community, always has been, and it's not a partisan issue. It's not a Democrat or Republican issue to support our military families. And I believe fundamentally, the stronger our community at integrating people, the more resilient we are. And so Blue Star Families is such a great partner for us. And a lot of what they do is create that soft landing for families when they come to my district. And my district office does a similar thing. So we've helped countless military families, whether it's DMV and the license plates, or whether that is with, property taxes, all these different things. We provide that resource of, you're in this new state, you have to deal with a bunch of new state bureaucracy, and we're here to, help hold people's hands. But we also go beyond that, and we really try to partner with our great community organizations, and we have tons of them in my district. Obviously, I represent Camp Pendleton as well, and the surrounding communities of Oceanside Vista, Encinitas, and Carlsbad. And so you have a lot of people who are former military, or military spouses who are currently serving. You have a whole, who work with Camp Pendleton. We have a whole range of people. And so I think I love Rachel's reference to Putnam's Bowling Alone. I don't think I've heard it since the 90s when I was in grad school, but really ensuring that there's that connectivity. And during COVID, we've had to go even farther because we know a lot of the military families are struggling with the kids in distance learning. A lot of our military spouses are struggling to work from home and make sure they're, helping their kids out and doing all those things while their spouses are deployed. So our office does everything from helping families get access to food resources to really ensuring and lifting up those organizations like the Veterans Association of North County and connecting military families. And I love our Blue Star Families. Their chapter-based model really makes it easy for us to partner with them, to understand the issues, and really use social networks to understand in real time what are people struggling with? Where do I need to be putting my energy to make a difference? Because we know as soon as those people become, as soon as military families become integrated with civilian life, and we know that connection is desired. So sometimes it's just connecting the two dots. And so my office does a lot of that. And I see this at the local government. I know I do it at the state level, and I know our Congressman Mike Levin does it at the federal level. I serve on the Veterans Affairs and Military Service Committee, as does Mike Levin. So I think what we see is there's this synergy. And I always say, sometimes things aren't additive, but they're exponential. And that is a really good description of when we create connectivity in communities, we're not just that little bit more resilient, we're dramatically more resilient.
That's so great. Thank you so much, Assemblywoman. Great to be with you. And next, I'd love to bring in Natalie from DRK. And Natalie, you and your team do so much to support amazing social entrepreneurs, and the organization is so thoughtful about your theory of impact and the philosophy behind it. And I know that a big part of that approach is sort of coupling this project stage unrestricted funding and combining that with ongoing sustained leadership support. That you guys have a long track record of impact with that approach. So can you speak to us a little bit about that approach and how it might relate to this conversation?
Yes, thank you so much. I'm really delighted to be here. So the Draper Richards Kaplan Foundation is a venture philanthropy. And what we do is we look for founder-led early stage organizations that are addressing really important big problems. And we partner with those entrepreneurs to really help them scale the work. And so we have an unrestricted grant, but more importantly, we take a board seat on every organization that we support. And we really try to help build the capacity of the organization, both at the organizational level, but also at the board level, to really help get the organization ready to scale their work. And so what was really interesting to me is that fundamentally, in order to be able to scale, you have to be able to measure the impact of your work. And so I was really thrilled to read the report. And for me, measuring impact does two things. It helps you prove that the work you're doing is really working and impacting the population that you're trying to reach and solving the problem, but it also helps you to improve your work. And that's really fundamental, as there's so much that changes that you have to be adaptive as an entrepreneur and a social entrepreneur to be able to be effective. So I thought the research that was done was really powerful, and we found that those organizations that are most successful and able to scale really embed this notion of impact measurement into their work from the get-go. The other thing I was thinking about is that Vivek Murthy just published a book called Loneliness. Actually it's called, I think it's called Together, the Healing Power of Human Connection. And I think we're facing worldwide a sort of an epidemic of loneliness right now, and that's surfacing in a lot of the work and in a lot of the countries that we work in. So I have the privilege of supporting and serving on the board of an organization that works in Zimbabwe called Friendship Bench. And really what they do is to provide cognitive behavioral therapy provided by lay people in communities that don't have any access to mental health services. But really what they are trying to do is to create a sense of belonging and hope. And so I see that this is really a global phenomenon, and it's such important work. And so it's just been great to get to know Blue Star Families better and see how they really are addressing a very important but kind of a global problem, and just the way they have been able to leverage this impact evaluation, I think is really exciting.
Thanks so much, Natalie. Vilas, it's always so nice to be with you and to bring in Patrick J. McGovern Foundation.
Thanks, Greg. I'm super happy to be here.
So Vilas, the foundation focuses on the use of technology and data to create a more equitable, sustainable, and thriving world. So could you share a few examples of how the use of data can actually help to create stronger communities as well as deeper individual engagement?
Sure, Greg, thanks. And I have to say, I'm so honored and thrilled to be here with our soldiers, our sailors, our airmen, our Coast Guardsmen, our guardians, our Marines, and most importantly, their families. I've been thinking a lot in answer to your question, Greg. I was looking at my phone earlier and I realized how many apps I have that promise some form of connection. The Facebooks, the Twitters, the many new generations of social media. And yet I think back to when I felt most connected, and it's probably growing up in a small town in downstate Illinois and knowing my neighbors and knowing the people across the street and knowing that if there was ever a matter of common cause, I knew where to go to find help and support and companionship. You know, we think a lot about examples of data, and I'd love to talk a little bit about where those examples have even surfaced in this community. But what's really important to me is not the collection of data, it's not the surveys, it's not the insights that come out of it, but how we as communities step forward to become stewards of our own data, to take action because of what it shows us, and to advocate for a better world. So a couple of examples I wanted to share with you, one kind of in the big frame, and then one with our military families. Greg, you've probably heard me talk about this term, the asterisk nation. This is a term that's been coined really because of a great tragedy that's happened right here in our country. Indigenous populations and Native Americans that for many years, as the government has tried to conduct census and try to identify populations, has found that gathering data about and within these communities has been so hard that they've just been represented in census data tables as asterisks, not even defined by a number, but really sent sort of into kind of an unknown and abstraction. One of these incredible sources of hope for us now as we look out at the world is these communities coming together to take ownership of their own data, to coordinate gathering among their people, their families, their communities, and saying not only do we exist as we know it, but we now demand to be seen and to be heard. I think there's real power in that lesson of, as communities across all kinds of domains and different perspectives, to say, you know, we no longer have to wait for somebody else to name us and to give us identity, but we can step forward and name ourselves. I'm reminded of the incredible story of how families came together in the early 2000s as data finally began to emerge that demonstrated the costs of under-equipping our soldiers in the field, of not issuing the right kind of body armor, a practice that had continued for way too long. And the combination of data that was gathered around that and the advocacy of military families is what led to a real policy shift and a transformation. And I will say that the only reason I think that happened is because data enabled community to come together, to act together, and to really look for a better world for our people and our shared identity. If there's one thing that the Patrick J. McGovern Foundation thinks about, it's about data not as an outcome, but as a tool that leverages our own humanity and lets us come together in communities. So I just want to close by saying, this audience that we're talking to, I am just so enthralled by the resilience that's shown, right? Families that already have so many complexities going on, and then in the time of the current pandemic. But resilience isn't invulnerability, right? That at the end of the day, resilience comes out of community, and it comes out of banding together in common action. Thanks, Greg.
Well, thank you, Vilas. That was fantastic. Thanks for the insight and perspective. So next, Fagan. It's great to be with you, Fagan. We've been in touch over the years. I've always wanted to get to know you better, so I'm really happy to be with you.
Likewise. Thanks for having me.
That's a pleasure. So I'm wondering, Fagan, given your current work at Rethink and the strategy on building stronger communities by capitalizing infrastructure that could also help build stronger civil military communities, what lessons from that work sort of might you offer and bring into this conversation?
Sure. Well, first of all, thanks for having me, and so many kudos to the Blue Star families for the work you all do. My mother was a veteran. My older brother is a veteran. It's unbelievably important, and it's easy to take for granted. So I just want to take a minute to say thank you. Thank you for your service. Thank you for everything that you bring to our country and our community. I come to this work in community development wearing two hats, obviously doing the work that we're doing at Rethink, which is reimagining how we do development. And then also as the CEO of Baltimore Corps, which is actually a national service organization inspired by the national service movement and civilian service. And what we see in that is that development should exist to serve people, and development should exist to serve community. And when it doesn't, development is divisive. And it actually exacerbates trends of inequity, of inequality, of disinvestment that are entirely unhelpful. And this extends to the military community and extends beyond the military community. And so what we're doing at Rethink that I really love is that we have a broad view of stakeholdership when we think about community development. If we work backwards from the premise that development should advance the interests of community, then the inputs around development start to change. It becomes less about maximizing profit and more about maximizing health and well-being for residents in a community. What you're seeing right now is that there is a dearth of affordable housing. So that's capital A, affordable housing, and that's lowercase a, affordable housing. What you're seeing now is that there's profound disconnection in our community. We do not know our neighbors anymore. We don't feel like we can relate or connect across lines of difference. And development traditionally, frankly, has exacerbated those negative trends. I'm here in Baltimore City. I love my hometown, but everywhere I look, you can see luxury towers going up, and the waiting list for a small number of affordable housing developments get longer. And you can see a city that is very diverse with people from all walks of life and all backgrounds walking on eggshells because we don't know each other. And so when we think about development, there's a few principles we should keep in mind. First of all, development should be integrated. It should be bringing people together across lines of difference, including and especially class. And so what does that mean? It means development and the development products need to be calibrated to what people need. Specific to the military community, we really, 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 really need workforce housing. We need housing that is calibrated to the wages that people are earning. We need housing that builds communities along affinities related to work. I saw this with my mom. She left the military, and that was an incredibly tight-knit community where she had a lot of people she identified with who came from all over the country and all over the world. And then you step out into the world and it's no longer organized that way. And the communities that we live in are actually not intentionally set up to facilitate or nurture that. A second principle is that development needs to be responsive. We need to listen. Like, we're there to strengthen community and reinforce the best attributes and features of community, not divide it or extract value from it. And so too often when we develop in a vacuum. A small group of decision makers get to decide what gets built here instead of really listening to the people who live here and asking, what do you need? What do you want? What's missing? How can we complete the picture and the puzzle? And then if it's something that requires us to get creative, well, then you do tax credits, or then you engage philanthropy, or you use venture debt. We're in a really amazing time where there's a lot of flexibility and facility around capital markets, around getting creative with solving problems. And so there's really no excuse why we can't meet communities where they are and fill those invaluable gaps. The last thing I'd say is development needs to be connected, and it needs to connect to the things that are truly important. If you do an affordable housing or a workforce housing development, and there's a special focus on supporting our military communities, we should be asking what else they need. And we should be working with other developers, the city, the county, the state, to bring in those other resources and supplies, whether that's clinics, healthcare facilities, mental health institutions, arts and culture, things for childcare and after school. Let's not forget about our women who are also veterans and the many unique and particular burdens that they're bearing and enduring. To get there, you have to listen, and to get there, you have to care. And so I don't think development needs to be a dirty word. It often is. It certainly is here in my hometown of Baltimore. I think it's that way because we let it be that way, and we let incumbent interests kind of overwhelm common sense. When we listen, when we're responsive, when we have an eye towards integrating and strengthening our community, it can be a force for good.
Megan, thanks so much for bringing in that really powerful perspective of how development can and should work, and how people should experience that in communities. We appreciate that a lot. So let me now turn to Debbie, and then we'll turn to Megan, and then wrap with our wonderful hostess, Kathy. And I know that both Debbie and Megan are longtime and deep partners at Blue Star. Debbie, you at Rancho Santa Fe Foundation. So Debbie, what I'd love to ask you is how could your model of connecting needs with community leadership, personalized service, and grant making be applied in military communities to increase community building?
So thanks, Greg. It really is an honor to be here with all of you today. The Rancho Santa Fe Foundation is a community foundation, and so our goals revolve around supporting our community in many ways. And as Tasha mentioned, San Diego is a major military community. Rancho Santa Fe is where many World War II veterans retired to when their service was ended. So we have an extraordinary number of veterans in our local area. Those veterans generally have children who are also serving. And so when we first started to work in this space, we wanted to provide support to junior enlisted military families because we believe, as the COs have so eloquently stated many times, that if the family is taken care of, then the service member can do their work without worrying about what's going on at home. So that was our goal, to support junior enlisted military families. So we got to know the organizations that were doing that work. And we take pride in the fact that we got to know their leadership, got to know their clients, listened and heard the stories of the people who were so resilient in face of all the challenges that they had. So we created this directory that we have that's a vetted list of organizations in the county of San Diego, because our grant funding stays local. That directory is used as a resource by military families to connect them with services. It's also used as a resource to our donors who want to provide support to other military serving organizations. So one of the ways that we are able to build this community and the connections between the civilian world and the military community is through some events that we have. And we hold a number of different events, albeit this year they've all been virtual, unfortunately. But we bring people together from the military community, from the civilian community, from the philanthropic community. We bring everybody together to have a conversation from subject matter experts, so they get to know each other. We do something every year with our board of directors where we bring all of our grantees in. because they have great stories to tell. And so our board gets to know what's happening in the military community. Those representatives can share their stories and challenges. And it turns out to be one of the favorite events of the year for our board of directors. But by sharing those stories, I think we're helping to bridge the divide. And we've also made it a priority to focus our grant making on organizations that have programs like Blue Star Families does, that bring families together so that there is less isolation, more connectedness, more sense of community. We like supporting organizations like Blue Star Families, Support the Enlisted Project, the Military Family Collaborative. We have even helped establish a full-time military reporter for our local PBS station in San Diego, because we think it's important for the community at large to hear those stories and open a pathway for connectivity and community there. So those are some of the things that we have done. We really do feel a strong sense of connection to our military community because they're our neighbors, they're our friends, they're our relatives, and they're our teachers, they're our community. And so we want to continue to reach out to them in every way that we can and support the organizations that are really doing incredibly fine work in dealing with those community issues like Blue Star Families.
Thanks so much for that, Debbie. Turning next to Megan. Megan, it's really good to be with you.
Nice to be with you, and it's a big task to go last. This is exceptional. I've taken so many notes of my own today from all these amazing panelists.
Well, we're so excited to bring you into the conversation. And as mentioned earlier, I know that you and Starbucks are terrific and longtime partners with Blue Star around a series of campaigns and other things, and especially around spouse employment. And so, Megan, I'd love you to come in if we look at the connected community research, and that it in fact indicates that employment satisfaction can even be more important than employment status in achieving desired mental health outcomes. I'm wondering what that implies for employers like Starbucks and your role in encouraging supportive communities.
Yeah, I was so struck by this finding, and it really resonated with me and reinforced something that we think about a lot at Starbucks, which is our responsibility to create an extraordinary environment for our partners, our employees. And I think that is, as the Business Roundtable is talking about what it means to be a company and a corporation and our responsibilities, I think that probably resonates across the for-profit sector. Our mission is to inspire and nurture the human spirit, one person, one cup, one neighborhood at a time. And that human spirit that we're working to inspire and nurture has to start with our partners, our employees. And we know that. And this research really helps us to helps reinforce that we're on the right pathway with that. I was struck by what Megan was talking about around community development and listening. And for us, I'm sitting here at one of our community stores, and I'll talk a little bit more about our military family stores and our partnership with Blue Star Families. But we talk a lot about listening in our communities. But our first community, our first team are our employees. And we can't have employee satisfaction. We can't have strong mental health outcomes for our teams without that really intentional, broad scale, small scale listening. And I think that's where it starts. It starts with the individual connections between leaders and their teams. It's the peer connections. It's the connections across company, across the country and across the globe. It's that connection to feeling something bigger. And I would say that the other thing that we've learned over the last few years is that it's not enough to listen, and it's not enough to respond, but that in order to have that sort of healthy, productive, collective relationship, we have to co-create. And that means that it's not like a listen, then we do. It is a we work together to find the solutions. We talk about whether the solutions are right. We bring forward ideas from all levels from across the company, and that when we're looking at solutions, we're looking at the solutions that hit a couple of different factors. That first, that help the individual, right? This year, that means a ton of extra support and resources in response to the pandemic, everything from hazard pay to additional childcare to just solving the everyday stress that everybody is under in different ways. It also means feeling connected and feeling proud that what you are a part of and what you're dedicating your time to has a bigger purpose, and that together all of these individual things that we're doing are creating something bigger. And I think that goes to like the small level of connectedness, the connectedness that we've talked about on this call around neighbors, and it also brings that sense of connectedness in a global sense. I think only when we're doing that as a team of hundreds of thousands of people that wear the green apron across the world, are we able to spread that sense of inspiring and nurturing the human spirit more broadly. And I want to share a story from one of our military family stores that we have, that we operate in partnership with Blue Star Families, and that the extraordinary chapter leads and volunteers and families across the country help to bring this sense of connectedness and culture and community to life in these stores. We have a store here in DuPont, Washington, near Joint Base Lewis McChord, where we have a store manager who went through an exceptionally challenging time with young children and deployment and spouse deployment, and just really was having a hard time. And her Starbucks family and her Starbucks support network were able to help build her back up, help find her childcare, help work collectively with her. And she then built an extraordinary relationship with Blue Star Families chapter and brought to life the Yellow Ribbon Tree program. And we had a customer come and share a story where she, like a Blue Star Families team member come and share a story where she had set up the tree. It was her tree, it was her program. And one day she came into the store and there was a yellow ribbon for her husband on the tree. She didn't know who put it there. She has no idea. But the whole point was that we had this healing and collective support for our partners, our employees, our store manager, and she then was able to help bring a partnership to life and spread that joy in her community. And to me, when I was reading all of this research and this sense of connectedness, that was just a phenomenal example of when we do that whole pathway well, what the ripple effect can be and what the that extended community impact can be. So really glad to see that the research upholds that feeling that we all have, and really proud to partner with Blue Star Families on this work.
That's wonderful, Megan. Thanks for the thoughtful answer and contribution. Really appreciate that. Now we'll turn to Kathy, who we all know and love as the fearless leader of Blue Star Families. And Kathy, would love to bring you in around the idea of stakeholder theory, which is that the purpose of business can and perhaps should be to create value for stakeholders, not just shareholders. And so I'm wondering, given your work, how have you seen this in practice? How have you seen effective stakeholder management actually improve community impact?
Yeah, I love the concept of stakeholders. And when I look at the people who are in this room right now, you are all stakeholders. And I think we all get so much better by listening and hearing from each other. So when you think of who owns military families, well, we own ourselves, right? We need to care about our community. Certainly the military has to care about us, but the country has to care about us too, because we're there to protect the country. We aren't owned by the military, and the family members, certainly aren't owned by them. So the communities have to, but our businesses do too. Not only do we support what businesses do, but we work for them and the charities and foundations. So all of these segments, and certainly the local communities, the community organizations, so all of these folks really are stakeholders in not only solving our problems, but we have a piece in helping them solve their problems, which is one of the things that's exciting to me about this work. You know, the military has often created a model for how to do things better, whether that's integration starting in the 40s or childcare in the workplace, which is something DoD pioneered in the 80s. And maybe this idea that for military families to be healthy so that our military can function the way we have to, we need to find a way to create belonging. Maybe that's a model not only for our community, but for so many communities, right? Whether it's immigrants or low income or elderly or really just all of us. People said so many things that really resonated for me in this, this conversation. Fagan, what you were saying about intentionality, one thing that we really learned by iterating on our work is that intentionality matters. At first we thought, oh, we just need to bring people together. We just need to have events and then people will make connections and all will be well. But it turns out that's not true. That if you go to a church and synagogue and there's 1,000 people there and no one welcomes you, afterwards you may feel worse, you know, than you did when you went in the first place. Having moved to a new town. If someone doesn't welcome you, if someone doesn't look you in the eye and say, I'm glad you're here, welcome, if there's not that intentionality around what you do, it doesn't get you there. You can have 1,000 excellent service providers, but if there's no connection to that service provider, no bridge that opens up the door and makes you feel you're welcome there or you belong there, then those resources are never going to get to you. And these are things that we learned over time. So Bristol Myers Squibb Foundation, they have a grantee summit and people come together and they talk about their lessons learned. Listening to those things helped us learn about new things to try. Nation Swell will have these, you know, dinner table conversations where people will talk about their different experiences and you can listen and learn. I think that kind of stakeholder sharing creates enormous productive difference. And that's what got us there. I mentioned that we learned about intentionality from this pilot and that we have to not just provide connection, we have to provide welcome. It's a big focus now for Blue Star families is, you know, creating a welcome, but then the goal is belonging. Because once you feel you belong, then you can call up that friend and ask for help. That experience that Vilas had growing up. When I was in San Diego, we were stationed in San Diego and my husband was active duty, that's a military town, right? Super military friendly. But when my second child was born, I had to leave the hospital after 2 days because my husband was called off on a secret mission. And I had to leave after that C-section, even though I had a 4-year-old, because I had a 4-year-old at home. And with an infant and a 4-year-old, far from family and friends in a townhouse, my stitches failed. And I didn't have any, and there probably were a lot of service providers that could have helped me, but I need a person. I needed someone who cared. And if I wasn't in a military family, I wouldn't have been so far from family and friends. I would have been in the hospital and someone else would have been with my kids. So we need to provide those organic connections so that people can solve their own problems and, you know, and then make their community stronger in turn. The last thing I wanted to mention that really resonated to me is what Rachel said about creating meaningful work. And it goes back to also what Megan was saying about the role of Starbucks in creating meaningful work, that we thought at first, oh, employment equals connection equals belonging. But it's actually a more complicated story than that. It's not just employment. It's this idea of meaningful employment, which to me goes back to this idea of intentionality. We need to not only intentionally welcome people to our community, but intentionally create meaning in our workplaces. And those are all things we can do. We have data that can measure the need to do that and the benefit that comes from it, but data won't solve it. That's where the humanity comes in. And that's where each of us, I think, can use the data to create the humanity that will give us all a really better experience in our country. So thank you. Thank you all for being part of this conversation.
Well, thank you, Kathy, for bringing us together and for the work that you and your team do to support military connected families. Thank you for the great contribution of this study and all of the powerful insights therein. Thank you all so much, all of the panelists, the speakers, for each speaking to a certain dimension of this, and as a whole contributing to a really kind of rich, robust conversation. And it also felt like we were talking about community. We're all connected to community, but I sort of felt that sense of community even in this, virtual realm for an hour with this great group. And that, of course, is a testament to everyone here, and also to sort of the sense of community that you foster, Kathy, with Blue Star, and our connection to your mission and the work that you're doing. So just a real joy to be with this great group and participate. So thank you to you and your great team and everyone who worked on putting this together. So Kathy, happy to hand over to you to close us out.
Greg, I cannot thank you and the team at NationsWell enough for all your leadership and for your collaboration today. You've built a tremendous community, as I've mentioned before, and you've been impacting our world through social innovation. Your work to identify pioneers who creatively move the country forward and drive social impact is changing the world. And we're honored to work with you today. All of us at Blue Star Families are honored. I'd like to especially thank Alyssa Dole from your team, who worked so hard. Thank you, Alyssa. We're so grateful to your work. And to all of our roundtable participants, thank you so much for joining us and sharing your thoughts. We're excited to see what the future holds and how we can continue our collaborations to connect community and to support each other, to learn from each other. In a gesture of appreciation, we have sent all of you boxes. And if you have them with you, I would like to invite you to open them now. This is another moment of a community since we can't be together. Go ahead and, yes, pull them out. And this is our way of saying that you are now part of our Blue Star family. So welcome to the family. You belong with us. They're a small token of gratitude. Yes, there it is, for all you've done for us today. I have to tell you, this Yeti mug is one of my favorite things. So I hope you use it in good health. As we know from today's awesome, and Dog Tag Bakery, a wonderful partner, training vets.
Awesome.
As we know from today's robust discussion, military families thrive when they're connected to their communities and feel a sense of belonging. In order to keep connecting military families, we're seeking support for the following areas. Every September, we are hosting a Welcome Week, because 600,000 military-connected families move every year. 400,000 with the Department of Defense, 200,000 transitioning out into their local communities. That's a huge number. And if people get welcomed in that early moment, they will really thrive. If they don't have that moment of welcome, you can continue on feeling isolated. So we are trying to create an opportunity, a moment of welcome, so we can let people know, we know you're here, we're glad you're here, and we want to have you part of our community. So we'd love for people to learn more about that. Help us host those activities locally, nationwide. Sponsor one of our 11 chapters where we do programs such as Blue Star Museums, Blue Star Parks, and book clubs to foster civil-military relationship building. Empower military spouses to gain meaningful work in your community or in your own company where you work. You can sponsor a Deploy Fellow. These are our racial equity leadership training programs. Military families of color have a compounded challenge in finding belonging in the communities where they live, particularly some of the places where the military moves them. Our Deploy program helps reach those underrepresented members of our family to help get them to the resources and sense of belonging they need. And also, we encourage everyone to improve their own military cultural competency, because when people know the right words to use, when they understand something about the history, they make those around them feel more comfortable. We can't do this important work without you. We thank everyone who is watching today for joining us on this journey. Thank you, NationsWell. Thank you to the Sorensen Impact Center, who has been a fantastic research partner. Thank you especially for Bristol-Myers Squibb Foundation for supporting the Connected Communities Impact Study and for all the work they've done in fostering early stage impact investigations so people can launch in meaningful ways. Thank all of you for joining us in today's robust discussion, and I look forward to connecting to all of you soon. Have a great afternoon.